going to introduce Dr. Scott Olitsky, who is the Section Chief of Ophthalmology at Children's Mercy Hospitals and Clinics in Kansas City, Missouri. He is a board member of the International HHT Foundation, and we're going to hear all about HHT and similar topics. Good morning, Dr. Olitsky.
Good morning. Thank you for having me.
And thank you for being here. So I started out by saying that many children get nosebleeds, which are generally not serious, but they could also be a symptom of a more serious condition called HHT. So I would like you to define that, and then we can get started talking about it.
Okay, thank you. That's right. So nosebleeds are a fairly common problem among many people, including children. But we're talking about a subgroup within that population, people who tend to get frequent nosebleeds, and sometimes people who may not have all that frequent nosebleeds who have a more serious underlying condition called HHT, or Hereditary Hemorrhagic Telangiectasia. Those of us who went to medical school some years ago, other older patients may know the disease better as Osler-Weber-Rendu, but most people refer to the disease now as HHT.
That is how I knew it.
Yes.
So I did not know right away what HHT was, but when I looked it up, I said, oh, we have a call from Mary in Washington about nosebleeds.
Okay.
Thank you. I'm calling because my son has been having nosebleeds in school, and I heard the other caller mention something about that it's hereditary. His father, as well as some aunts, uncles, and cousins, we just assume that this is something that's in the family and isn't anything that's to be concerned with. And we've gone to the school nurse and we went to the doctors who said we really shouldn't worry about it. And my question is, I'm concerned because we have had some sudden deaths in our family. I don't know if there's a relationship there, and if you could point me in the right direction, I'd really appreciate that.
Okay. Well, I think one of the things, as I mentioned with the last caller, very important in families who know that they have HHT, that they don't assume a child who isn't having nosebleeds doesn't have the disease. Just as important, and maybe even more important, are those children or those families who have multiple family members with nosebleeds. There are certainly many causes for nosebleeds, and there are a number of reasons why people have nosebleeds, but family history, I think, should really raise the possibility that this may be HHT. And it's interesting that the caller mentioned that the doctor didn't really talk much about HHT, but the incidence is actually fairly high. It's about 1 in 5 to 1 in 8,000. So to give you an idea, that's about the same incidence as cystic fibrosis, which most doctors know about. Unfortunately, many physicians aren't aware of the link between nosebleeds and the other disorders associated with HHT, or may not know much about HHT in general. That family history, the history of sudden death, if that may have been due to stroke, that would also be very suggestive, and not to alarm you, but I think it's something that probably you should look into, and you should speak to somebody who's knowledgeable about HHT. I think a child with frequent nosebleeds, especially with multiple family members having nosebleeds, should certainly warrant a workup. And we hear this all the time at the HHT Foundation. Patients who go and see an ENT physician for the treatment of frequent nosebleeds are often go undiagnosed. In fact, a recent study showed that decades can go by between the first treatment for a nosebleed in those patients and an eventual diagnosis. And one of the things, again, we hear very sad stories, tragic stories, all too frequently, is the family with frequent nosebleeds who are told nothing to worry about, and it turns out they had HHT, and an unrecognized brain blood vessel abnormality takes somebody's life unexpectedly. And again, these are tragedies that can be prevented. So I would say, I don't want to alarm you, but I would say that this is something I would speak to somebody who has some knowledge, and if that's not the physician that you're seeing, you can reach out to the HHT Foundation, and they can put you in touch with somebody who can talk to you more about that.
And Mary, you're in Washington, it looks like, so I'm sure there are people in Washington.
Yes, there are a number of centers, I think 14 HHT centers of excellence, which are multi-physician centers that have specialists in all the areas that cover HHT, and those are great places to get workup, to be evaluated if there's a concern. But I think for a patient who may not be near a center, a call to the HHT Foundation will get them on their way.
Okay, thank you for your call.
but just because we are talking about HHT and nosebleeds, is that we do see a lot of patients who present to an ENT physician or to their primary care physician or pediatrician with frequent nosebleeds who get a workup for bleeding disorders, and because that comes back normal in most patients with HHT,